Dr. Cozy. I see that we have you here for a potential allergic reaction, which, judging by the looks of you, I'd say it's more than potentially. I am so sorry. Before we get into it, can I just get you to verify for me your name and date of birth? Perfect. Thank you. Well, do you have any kind of idea what you might have eaten, for example, that would have triggered this? Okay. Is this your first time having a reaction on this kind of scale? Yeah, okay. Are you having any difficulty swallowing or getting air? First thing I want to do before we go any further is just take a look inside your throat here, okay? So I'm just going to stick this tongue depressor open for me. Perfect. Okay. I just want to rule out before anything else any kind of throat constriction, which you can close. Looks like we're in the clear there, but we will keep an eye on that and check it regularly, okay? Is it okay if I put my hands on your neck? Thank you. I just want to check for any kind of swelling around the airway, just to make sure. Can I get you to swallow for me? Again. And again. Was that difficult at all? Did you feel like you needed to strain or force it? Okay. If that changes, again, I want to know right away, okay? Don't be shy, because we're here to make sure that you're okay. Your throat feels okay to me, though. Let's grab a temperature real quickly here. Okay. This isn't going to make any contact with your skin. It's just going to hover over your forehead. Okay. No temp, so that's good. Okay. Let's just take a listen here. Can I get you to take a deep breath in for me? And out. Good. And again, deep breath in. And out. Okay. I'm going to listen to your back. breath in and out. And one more time. Deep breath in and out. My stethoscope has stuck to my earring there. Okay. Well, your breathing does sound normal. Your lungs are clear. Your heart rate is nice and steady at 70 beats per minute. So I'm not too concerned about an airway constriction or anything like that. Just to be on the safe side though, I would like to hook you up on the monitor. That way if there are any kind of changes, an alarm will go off if I'm not in the room, for example, and we'll be alerted right away to come in and help you. Okay? It's just a little clip that goes on your finger, so you don't need to be too worried. It's nothing invasive, I promise. It's just that with this level of swelling, like around your eyes, you need to be alert and cautious just in case. Okay, so this guy is just gonna clip on your finger, just like that, okay? Perfect. That works. Okay. This is a little. I'm going to leave that on silence so it's not beeping away at us, but it will still sound an alarm if you stop breathing or anything like that. Okay, so let's take a look at your eyes here, okay? So, is it okay if I touch you? Thank you. First though, I just want to take a visual inspection. Are you able to open your eyes wider? Okay, so there is a bit of constriction here. You don't need to do anything, I'm just taking a look at your eyes here. At the sclera, which are the white parts, and the lacrimal ducts in the corners of your eyes. Keep your eyes open. Focus on my nose. keeping your head still. I don't want you to turn your head at all. Just using your eyes, I want you to follow my light. Good. Excellent. Put that away. I just want to palpate around your eyes to get an idea of the extent of the swelling, as well as to rule out if there's any sort of serous drainage or drainage that can be expressed. Seeing how far the swelling extends. Some more so into the cheeks than the forehead. And then our rash. So I see striations down the neck here. And just palpate to see if there's any swelling present or edema. Do you see some red dry skin on your arms? I'm not seeing the redness extending beyond the upper abdominal area, so that's good. Are you experiencing any sort of itching with the rash? Okay. I am fairly confident that this reaction is due to something you're allergic to, but just to do our due diligence, I am going to take a culture just to rule out any sort of bacterial or viral infection. But I'm 95% confident that it's going to come back negative. Regardless, we want to cover all of our bases here. So let me just grab a transport tube real quick. Looking here for a good site to take a collection. So I'm going to use the opposite end here just to irritate the skin just a little bit. There we go. Really quickly to hand it to an assistant. Angels, can you take this and get a requisition prepared for just culture and sensitivities? Perfect. Thank you. Alright. Just a second, sorry. I need to write up my notes on our exam so far while it's fresh in my mind. because you are having quite an extreme allergic reaction, but we're not certain what the cause is, and this hasn't happened to you before, I think it's really important that we do something called an allergy test, and I'd like to do 2 different kinds. The first kind I'd like to do is a scratch test, where I will be exposing you to some different allergens in droplet form, and then making tiny, tiny little pricks in the skin to try and elicit a reaction. The other type I would like to do is an intradermal test, where an allergen will be injected just into the surface layer of the skin to try and again elicit a reaction. These are in controlled amounts, so they will not trigger an extreme reaction beyond like some redness and swelling around the injection site. Should anything beyond that occur, we will be on it and take care of it right away for you, alright? So everything is controlled, and we will be taking care of you the entire way. It's completely understandable to be nervous. I completely understand. But it is mostly important that we keep you protected and prevent any sort of more extreme allergic reaction in the future. Because when somebody breaks out in swelling to the extent that you have, then there's always a future risk if there's a stronger exposure to that swelling extending into the throat and blocking your airway. We don't want that to happen. So it's really important that we're able to identify what the allergen is that triggered this kind of response. Okay. The needles are tiny, promise. It's a little bit of an irritating feeling, but it's not going to be like a shot. It's just like a little tiny prick, and then it's going to be over. And people report that the worst part of it is actually itching, not pain. So, if that helps alleviate any anxiety at all. Okay. So, give me just a couple minutes here, okay? And I need to draw up some syringes. I will be right back. get some gloves back on. Scratch my nose before we do that. So, right. Just taking a look at your arms here. Try and decide which one is the most ideal candidate, and I'm gonna say this guy right here, because I need to make sure that we're able to identify if there is a reaction. If there's too much redness, it's gonna be harder for us to see. So just gonna take out an alcohol wipe here. Okay. So I'm just gonna be cleaning up the arm just to make sure that there's nothing present here to give us a false read. Okay. Let that dry a little bit. Okay. So we're going to be doing the scratch test first. So in my dropper here, I have 6 different common outdoor allergens, such as pollen, for example, grass. So we're going to be doing those in the upper arm. Don't be alarmed by the syringes here. They are going to be used to irritate the skin, but I'll show you the needles are tiny. Stepping in advance, I'm gonna move our tissue here so I can set this on top where it's easy to access. Okay, so looks like that's nice and dry. like I said, you take a look at this right here. This little needle is very, very thin. So, you should barely feel it at all, right? So, I'm gonna first color it in here. And just having a drop. Okay. Poke. Just like that. Not bad, right? Not bad. To the side. Okay. Our next guy here. Okay. Halfway done with this part. You're doing great. Oh, come on. Underneath. Alright. 2 more to go. That part is done, but I am going to take, so it's just like a little makeup pencil. I'm going to be labeling which is which with the number. keep track if there is a reaction. Take my garbage out of here, and then we'll get set up for the intradermal test, okay? So here. This stool here, we're going to have you rest your arm, okay? Not quite yet. I want to put a drape down. Okay. Now go ahead and rest your arm, okay? Okay. Is this okay? Are you comfortable? Okay. Because I can always put a towel or something underneath your arm to support it. Okay. Will you let me know, okay? So, to start here, I'm just going to be cleaning off the area that we're working with, okay? So, give it an opportunity to dry. While it's drying, I'm just going to lay out our syringes. Alright, that to the side, and I'm just going to label where these are gonna go. Alright. want to fix my 3 here. So now we're going to begin, okay? So number 1, and actually I'm going to stand to do this. I have more control. So just making sure. There we go. Like I said, just right in the surface. And done. It's okay if we have a little leakage there. This on here actually. Now we have our second. Again, just in the very surface part. Just gonna adjust the drape underneath here real quick. Alright. So now number 3. You're doing great. Okay. Now I'm going to move to your side. So on this side, just sit and lean here, okay? focus here. Alright, and the last one. You've been a great sport. I know this isn't easy. Alright. So, you can take your arm back, okay? And I'm going to move our tray out of the way here. Okay. Get this out of here. And this as well. So, just need to give those a few moments to do their thing. And while we're waiting, I'm just going to take a few notes here, okay? So, should have been enough time now. I'm going to move this back as well. So let's take a look at you here, okay? So I do see on the upper arm we do have some slight reactions to pollen as well as dust mites, which are common allergies, but the reactions aren't quite as dramatic to make me think that they caused your current state. And on your forearm, iodine has given us quite an angry response here, which makes me think this is our culprit. So, can you tell me what you ate for lunch? that makes sense. So, given that you have an iodine reaction, unfortunately, shellfish is going to be something that's going to be out in the future. You've never had it before? Yeah. Same thing is going to go for if you get injured in terms of like cleaning a wound, or you need to have a surgical procedure. You're going to need to let people know that you have an iodine allergy, so that way they don't trigger a future reaction, okay? It's going to be really important for you to do your research about what contains iodine, so that way you're able to avoid it. And in case there is an accidental exposure in the future, we will prescribe you with an EpiPen, which is a device that injects a dose of epinephrine, which will help dilate the vessels so that you don't have any sort of constriction that could prevent you from being able to breathe, that might block your airway. Because you've had such an extreme reaction, I'm going to do a repeat exam just to make sure that everything is okay here. So starting with your throat, just get you to open up for me. Beautiful. Just taking a look here. Inside of your throat still looks nice and clear. Let's check the outside. So, can I get you to swallow? Okay, and again. Okay, changing my placement. Again. And again. Okay. Just gonna palpate and make sure I don't feel any increased signs of swelling. Around your eyes. Just looking at your skin again as well. Take a look at your eyes. Look up for me. Keep looking up. Okay, and then I'm going to hold your lid. Look down. Look down. Okay. Keep looking at my nose. Good. follow my light. No turning your head. Excellent. Good job. Okay. Just relax. Okay. So, palpating just around the eyes again. I know I did it a moment ago, but I was looking for something else. Now I'm checking the interorbital space, infraorbital space. Okay. So it doesn't appear that we've had a worsening reaction after the allergy testing, which is good. So I just needed to rule that out. What I would like to do is keep you here for a little while for observation, just in case there is a delayed reaction in terms of any sort of like anaphylaxis or worsening of that rash or that swelling. So I will be having a nurse come in here about every 15 minutes to check in with you. If after an hour we don't see any changes, then we'll get you discharged to go home. Before I step out though, just make sure I get some information from you, because I'm going to be prescribing you, like I said, an EpiPen, so that way if you do have an exposure in the future, you'll be able to treat yourself. So let me just make sure. Okay, so you did put down your pharmacy. So I'm going to give you 3 refills, but you will want to pass this along to your primary care physician. We will be forwarding your chart notes from today, so they will have all of the information. It is really important that you keep your EpiPen on you, particularly when you leave the house. When you're at home, make sure that it is in an easy to find place. That way, if in fact you do need it, you know where to look, and we can avoid any kind of issue with time being lost searching for it. Do you have any questions before I step out? Okay. Well, if you think of anything, let a nurse know. They can grab me to come back in here, okay? It was really good to meet you despite the circumstances, and I'm glad we got this taken care of and identified for you. Take care.